Hi everyone, I'm SHABIL AHMAD bin Abdul Samad. My matrix number is BM24110027, and today I'm going to talk about the heart. So first of all, let's look at the anatomy of the heart. At the innermost layer, we have the endocardium, then we have the myocardium, then we have the epicardium, and then we have the pericardial cavity here. Then we have the parietal layer of serous pericardium, and the last layer is fibrous pericardium. Now let's look at the anterior view of the heart. So here we have the superior vena cava, then we have the right atrium, the right ventricle here, and left ventricle, and also the left atrium. And we have the inferior vena cava at the bottom and superior vena cava at the top. And we have the aorta here and the pulmonary trunk here. If we look from the posterior view, we can see the left pulmonary vein, two of them, and two of the right pulmonary vein here. Now let's look at the inside of the heart. So the inside of the heart has four chambers. We have the right atrium and ventricle. We have the left atrium and ventricle. The left side and the right side is separated by the interatrial and interventricular septa, and between the atria and the ventricle is separated by the atrioventricular septa. There are four valves in the heart: tricuspid valve, mitral valve, aortic valve, and the pulmonary valve. Now we're going to look at the physiology of the heart. From the aorta, the oxygenated blood will be brought to the whole body. Then from the body, the deoxygenated blood will be brought back to the heart through the superior or inferior vena cava. Then the deoxygenated blood will go through the right atrium to the right ventricle and will be pumped to the lungs through the pulmonary artery. Then in the lungs, the blood will be oxygenated, then will be brought back to the heart by the pulmonary vein. The oxygenated blood will go through the left atrium and left ventricle and will be pumped back to the whole body through the aorta. There are three phases of the cardiac cycle. The phase one is atrial systole and diastole. In this phase, the atria will contract and the atria will undergo depolarization. In the cardiac cycle, the atrial systole and diastole is presented by the P wave. It lasts for 0.1 second. Then the second phase is ventricular systole and isovolumetric contraction. In isovolumetric contraction, the ventricle will contract and depolarize. Every valve will be closed and it will be represented by the QRS complex of the ECG. Then we have the ventricular ejection. Increased pressure higher than pulmonary trunk and aorta will cause the blood to be ejected to the pulmonary trunk and aorta. In this phase, the semilunar valve will be open. Then we have the third phase, which is the ventricular diastole. In this phase, ventricular will relax and repolarize. It are represented by the T wave in the ECG graph. It will last for 0.4 seconds and all valves will be closed. Ventricular pressure is lower than the atrial pressure, causing the AV valve to open. Then, both chamber would be in the diastole stage. Now let's look at the biochemistry of the heart. The cardiac action potential graph is what we are seeing now. And at the start point, we have the phase 4 where voltage-gated K+ channel remain open. Then we have the phase 0 where rapid depolarization due to sodium ion inflow when voltage-gated are open. First, sodium channel will be open, then the inflow of sodium channel will cause the membrane potential to go up. Then we have the phase 1 where the closure of sodium ion channel are closed. Then we have the plateau, which is in the phase 2, where maintain depolarization due to calcium ion inflow when voltage gated slow, and calcium ion channel open, and potassium ion outflow when some potassium ion channel are open. Then we have the third phase where repolarization due to closure of calcium ion channel and potassium outflow when additional voltage gated potassium channel are open. Now we're going to take a look at the disease, treatment, and technology used for the heart. These are the example of coronary heart disease. This is the picture of healthy heart, healthy artery, and this is the photo of beginning plaque formation, and this is the increased plaque accumulation, and this is a picture of narrowed artery blocked by a black dot. Arteriosclerosis of coronary artery will cause mismatch between oxygen supply and demand of the heart. Low oxygen supply will cause myocardial ischemia or even infarction. Common symptom of coronary heart disease is dizziness, shortness of breath, sweating, and nausea. Now let's look at the medical procedure and intervention for cardiovascular disease that I just mentioned. There are two parts that we are going to focus, procedure that we are going to focus, which is the angioplasty and coronary artery bypass grafting. For angioplasty, a catheter with a balloon is inserted into the narrowed artery. The balloon is inflated to widen the artery, and a stent is often placed to keep it open. Technology used for angioplasty is drug-eluting stent, also known as DES, where the stent is coated with medication to prevent re-narrowing. Then we have the intravascular imaging, where tools like intravascular ultrasound and optical coherence tomography will provide detailed image of artery during procedure. For coronary artery bypass grafting, it's a surgical procedure where a healthy blood vessel from another part of the body is grafted to bypass the blocked coronary artery to restore the blood flow. Technology used for CABG is for minimally invasive CABG, a small incision is made instead of open chest surgery. Then we also have robotic assisted surgery for precision and shorter recovery. Emerging treatment and technology used for the heart is bioabsorbable stent, where dissolvable stent that reduce long-term complication. Then we have gene therapy, where investigational treatment are used to target gene to repair damaged heart tissue. Then we have regenerative medicine that use stem cell to regenerate heart muscle damaged by CHD. Then we have the robotic and AI-assisted surgery to improve precision, reduce risk, and aiding recovery. Now we're going to take a look at the famous practitioner for the heart. We're going to take a look at Dr. Michael DeBakey, which is an American general and cardiovascular surgeon. He's a scientist and a medical educator who became chairman of the Department of Surgery, president and chancellor of Baylor College of Medicine at the Texas Medical Center in Houston, Texas. He developed a version of the roller pump, which he initially used to transfuse blood directly from person to person. This later became a component of the heart-lung machine. There are few surgical innovations of DeBakey's, one of it being the procedure to repair aortic aneurysm and dissection. He also innovated the development of ventricular assisting device and the prosthetic vascular substitute. He received a few awards, which is the National Medal of Science, the Albert Lasker Award, and the Presidential Medal of Freedom. That's the end of my presentation. Thank you very much.